Good morning, good afternoon, and good evening. Ladies and gentlemen, many thanks for listening in. I wanted to take some time to talk about Dr. John Anthony O'Malley, MB, CHP, MRCGP, MFM, LM. He's a young man, and I've known him for the last 7 years. So where do I begin? How do I define him? So he's the Medical Director of Mastercall. He's a GP. He's a gastroenterologist. He's a family man. He's a leader. He's someone the patients would describe as a godsend to heal their sufferings. He's a man with wisdom of 60 and the energetic drive of a 30-year-old. He cracks jokes quite often, even with patients. I always laugh at his jokes, as I never know it might be a loyalty test. So I had the job interview, and John asked me about my greatest strength. I told him I'm hardworking, and when he asked me to explain, I told him that if there is an easier way to do my job, I'll still do it the hard way. I asked him to give me a high salary, and he asked me why, and I told him that the job is so much harder when you don't know what you're doing. John O'Malley wanted me to change the way things work. I just refused flat out. I told him implementing changes won't be easy. I'm pretty set in doing things the wrong way. One day he came and asked everyone, "Why aren't you working?" And we all replied we didn't see him coming. One day he told us to have a good day. So guess what we did? We went back home. One day he sent me an email to send him one of my funny jokes, and I replied, "I'm working at the moment and I'll send you one later." He replied, "That was a fantastic joke. Send me another one." We both have two things in common, and they're work and hard. He works hard, and I hardly work. We have a rule at Trafford: no man goes before his time unless the boss leaves early. One day I was pulling my hair out, just looking at the list of things to do, and then Dr. O'Malley walks in. He tells me about a magical rule to organize things in 3 categories: things I won't do now, things I won't do later, and things I'll never do. Since then, I've been following this golden rule, and my life's so much easier. Thank you, John. Now, as he has a special interest in gastroenterology, and with a lot of us passing on lots of patients with bowel problems to him, he sometimes does get a bit annoyed. And one day he told me, I don't want to be the diarrhea doctor anymore. It was the first time I heard him say that. John enjoys my advice, and he really appreciates it. One day he told me that I give him sound advice, and then he explained it a bit more. He said it's 99% sound and 1% advice. One day I heard the news that a number of GPs have agreed to take action on a number of dangerous lifestyle issues affecting the GPs, including high levels of stress and long working hours. And little did I know that the best way to reduce the risk was by retiring. Retirement is fun. I do think about it often. When am I going to retire and live off my savings? And then what will I do the next day when the savings run out? So I hope, John, you've planned better than me, and I guess the mantra is goodbye tension and hello pension. John, you also need to remember one thing though, and that is that behind every retired man is a wife, and after a while she would be wishing that he would go back to work. So I'm glad that you would be coming back for some work for a few hours, and I look forward to that. As I mentioned, that John's the medical director, and to save time, I always like to assume that he's never ever wrong. Now, let's put the jokes aside, and I must say that he has been involved with a lot of activities outside of Mastercall as well. He sat on the LMC and he was involved in setting up the local leg ulcer clinic and viral diabetes register. He is the out of hours representative on the RCGP NHS 111 Pathways Clinical Governance Committee. He was secretary and web editor for the Primary Care Society for Gastroenterology. He has an international footprint. He sat on the committee of the European Society for Primary Care Gastroenterology. I do wonder whether he enjoys sitting, and hence he manages to chair a lot of committees. He was the chair of Primary Care Reference Group, which was part of the Department of Health's National Liver Disease Strategy Group. He has been the primary care member of the RCP IBD Audit and Registry Committee. He has been a member of the Northwest Regional Ethics Committee and sat on the BMA Medical Managers Committee. The Swiss government sponsored committee on care of ulcerative colitis. The committee had a UK primary care member of the EPATUC, and that was Dr. John O'Malley. He was founder member of the Rapid Learning Pilot for the NHS Alliance, which allows the sharing of best practice amongst out of our organizations. John was on the King's Fund Senior Medical Leadership Program, and he was a founder member of the Faculty of Medical Management and Leadership. He started lots of things. He has written and reviewed medical literature. He was the co-author of the first GP IBD audit. He is the reviewer of papers regarding out of hours for the RCGP journal. He has been book reviewed for BMA Book Awards. So if you're planning to win the award, let me know and I might put in a good word for you. He reviewed several map of medicine pathways, most notably the treatment of ulcerative colitis in a primary care setting and assessment of jaundice. Have you ever heard of NICE? The very nice people who make all these complex things easier for all of us to follow. So NICE could not have been as nice without John's contribution. He was member of the NICE Guidelines Committee on screening for celiac disease, fecal calprotectin, and most recently the IBD Quality Standard Committee. Now he set up a primary care endoscopy service which actually ran for 14 years. He's an excellent speaker, that is when I let him speak. I do bear witness to his brutal and pleasant jolliness at times. In 2013, he was asked to speak to Italian Medical Association on the subject of out-of-hours care and leadership. He has also been invited to speak at the Euro Out-of-Hours Net, which is a European research organization looking at out-of-hour issues. And since then, he's been involved in every meeting and he's forged links with both international and national research units. I would like to talk about his contribution at Trafford Health Centre. It's a great relief when he's in clinic, because not only does he see his pre-booked appointments, he contributes by seeing the walk-in patients, and then he clears all the document and results and sometimes prescription requests like a good boy. I must say that he contributes significantly more than his fair share in clearing up the workload. On his famous Friday clinics, when he's out and about and conducts home visits for housebound patients, and for many of them he is a godsend indeed. Where else will you have doctors injecting joints in the comfort of your own home? I've recently noted he extended his joys of these home visits, and he's been doctor by day and superhero by night. He's been going around on the Sunday nights visiting patients with his trusted better half and lifetime navigator, Mrs. O'Malley, dragging the madam in the middle of the night to make sure that the service continues to perform at its peak. You don't see a commitment like that anymore, do you? Now, sometimes when I review some of the patients who have been seen by John, I do find they are happy. They found him caring, understanding, offering choice where appropriate, and they find him pleasant. He's excelled in organizing complex care management of some of our vulnerable individuals. He's quite passionate about care of the patients, and when needed he would delegate, usually to me, and sometimes to multidisciplinary approach, and he would also follow the guidelines. John, I do intend to make one change after your retirement, and that is a signboard in practice. It would say, practice limited to simple, straightforward, old-fashioned diseases only. Hope you don't mind. Now, looking at his contributions to Mastercall, overseeing 100 plus doctors, nurse practitioners, managing to steer a social enterprise, out of our service, a GP surgery, the walk-in centre, the Northwest Ambulance Service pilot, the TCCC, is starting all these new services are a credit to his leadership. He has helped us all the staff feel confident in their domains, and we steer constructively in our roles. I truly commend you, John, for creating more leaders instead of mere followers. You know, Dr. O'Malley likes to consolidate and likes to get a good grip, a firm grip on the matters, and then set them on an autopilot and delegate them appropriately. And then he takes on the next challenge. He's a very committed individual. He steps in where necessary, and when he does, you have to make room. You have to give him space. He's assertive without showing his hammer. He's always encouraging us to self-reflect positively, and he promotes a good learning environment to tackle any issues. He's very fair, and wherever the opportunity arises, he would always encourage open competition. He has a very interesting way of motivating staff. Last year he gave everyone a £100 check, and we were all thrilled. And then he promised that if we work with the same zeal next year, he'll actually sign those checks. We're still waiting. I remember when he started induction and he started conducting the half-day training session in the out of hours. He's an excellent teacher, and sometimes he let us learn on our own as well. Now, with his support, we've had medical students in our GP surgery. He does support a good learning environment. He monitors and makes sure that the GP registrars in Stockport get adequate out-of-hours sessions with good supervision. Who doesn't know of the clinical governance thought of the week? He's practically doing our appraisals for us by sending those out, along with the clinical guardian. Now, he's been involved in starting up the community IV service, the IV antibiotic service, and he also provided the NVAS with the GP component, which has cut down A&E attendances and hospital admissions across Stockport and Trafford, and it is a major contribution. He organized the 7-day access to Stockport residents from the Mastercall premises. I've heard that there was once a divine decree to a nation in the past which says 6 days shalt thou labor, but I think that's not applicable to NHS contracts. He oversees Wellspring clinics that gives treatment to homeless and substance users. He looks after those who have been rejected by others. He is overseeing the clinical input to the Trafford Care Coordination Centre, dealing with the referral management to ensure patients are seen by the right person at the right time with all the relevant bits and bobs, the tests and all of the information. But this is a massive piece of work which I think he has contributed by starting and then delegating. He's been conducting appraisals of the salaried GPs and the out-of-hours GPs. He's conducted my appraisals, and he's been extremely quick but very formative in all these appraisals. I did ask one of my colleagues about the job, and he said picking the right boss is far more important than picking the right job, and John has been that right boss. So thank you, John. He's been demonstrating his commitment to bridge the gap between primary and secondary care. It is his contribution and hard work which makes Mastercall distinctive and proud amongst all of the other out-of-hours. Did you know that he has a master's degree in healthcare and healthcare ethics and law? He acquired it with a merit. His topic of research was moral responsibility for health. He then started upon a doctorate exploring the nature of the good doctor, A wise decision, I must say. It would not have been hard for him. All he has to do is look in the mirror and describe himself. But then he took on his famous Fridays at Trafford Health Centre, which compelled him to postpone his completion for his doctorate until later. His contribution to general practice has earned him one of the highest recognitions for the GPs, and that is a fellowship of the Royal College of GPs. I can only speak highly with the utmost respect for all of his hard work and support that he has provided for all of the staff in this organization. His vast wealth of experience and advice he entirely passes on to all is unparalleled. He has accomplished what few would dream of in a lifetime. There are many people who have been touched, but never inappropriately, and never without consent, by Dr. O'Malley. I have condensed my opinion, I must say, and I take pride in having lived in a time and an age, and having known his assertive yet noble and kind personality. Thank you, John, and best of luck to you. All the best wishes. Goodbye for now.